ఏవీస్ వాస్కులర్ సెంటర్ మన దేశంలోనే ద బెస్ట్ వెరికోస్ వెన్ హాస్పిటల్.
Namaste, welcome to iDream. I am your Vijitha with us now gastro-hepatologist Dr. Kavya Dendakori. Let's talk to Madam now and clear all our doubts. Namaste Madam. Greetings. Thank you so much. Madam, many people say that the liver is damaged. That means suddenly we know without any symptoms before. When we go for a checkup, what are the symptoms that we know, Madam, when the liver is damaged? This is actually a very important question in advance. I especially thought to create more awareness on this because now there are 3 stages of liver damage. 1 may be fatty liver. 1 may be fibrosis in its next stage. Its next stages may be cirrhosis. Cirrhosis means 80% of the liver damage, as lemon meant, so if 80% of the liver is damaged, we call it cirrhosis. Suppose once the cirrhosis stage is reached, the liver will never return to normal. So the only regenerative organ in our body is the liver, that is, the organ that regrows again. So if there is any problem with the liver cell will die, but once the problem goes away, the liver will regrow again. So the liver has that capacity, that tendency, that beautiful capacity, so fatty liver grades. I will tell you again as an eventuality, its next stage is fibrosis. Fibrosis means the liver becomes scarred, the liver becomes stiff, this stiffness, up to this stage, we can completely reverse it with the beautiful medications available now and make the liver normal. But once the liver goes to the next stage, that is, cirrhosis stage, which means 80 to 90% of the liver is damaged, the liver cells do not regrow, the liver does not become normal again, due to which the liver size becomes small. Even in this stage, 80% of people do not have symptoms. Forget fatty liver, forget fibrosis. Even cirrhotics, meaning patients with cirrhosis, may not have symptoms in 80% of patients with chronic liver disease. The most common symptom they have is fatigue. They think, last night I didn't sleep well, I didn't eat properly, I didn't exercise, I traveled, so that's what they think. But this is a long period. It is persistent throughout the day. So 80 to 85% of people generally have no symptoms, even in permanent liver damage. Okay madam, many people, as far as we all hear, only those who have consumed a lot of alcohol are affected. Is that really the case, or can it be damaged in other situations as well? There are many reasons. What we are seeing most recently is lifestyle diseases. Lifestyle diseases are alcohol-related liver diseases, as you asked. The second thing is sedentary lifestyle. Sedentary lifestyle means that now we can think of it as post-COVID. Everyone is working from home. So after that, it means that everything is coming to our doorstep. So through what medium is it coming to our doorstep? Sitting at home and sitting in one place, mobility and exercise have decreased, so the chances of obesity have increased a lot. So, whether it is children or adults, we call the liver problem caused by ethanol alcohol disorder-related liver disease. Also, non-alcoholic liver disease is non-alcoholic related liver disease. So the common thing in this is that, as I told you now, obesity is very common. The second thing is that uncontrolled sugars, even if the sugar is not under control, if they have sugar for many days, and if they cannot improve their sugar through diet, we get permanent liver damage. The second thing is, people with systemic hypertension, high blood pressure, next thyroid. Even if they have thyroid problems and do not take treatment, thyroid can also happen to them for many years. And polycystic ovarian syndrome in women, you may have heard of PCOS, PCOD. Okay, there is a chance that they can also get it. And obstructive sleep apnea. Obstructive sleep apnea generally happens to people who are a little obese, people who are a little overweight, they do not get oxygen properly. Okay, this is a problem in the lungs, so the most common symptom you see for them is daytime sleepiness. They fall asleep while sitting, they don't know it. So in such people, there is a chance of liver problems due to non-alcoholic steatohepatitis. Okay. Apart from this, there are also viruses, common viruses that damage the liver, such as hepatitis B, hepatitis C, hepatitis A, and hepatitis E. But generally they are acute viral illnesses, which means that jaundice occurs due to consuming contaminated water or food. Yes. But when our immunity increases, jaundice clears the virus. At least 80 to 85% of people, only less than 10% go into liver failure. So, okay, they don't have chronicity, that is, they don't have liver problems for many years. They get acutely. But 90%, 85%, 90% of them will improve. Only 10% of people have a high chance of going into failure. The rest don't. This is something that is seen more routinely. Next is autoimmune disorders. Autoimmune disorders, which is generally what our immunity does. Suppose we have a problem, our immunity helps to protect us from that problem. For example, suppose we have a fever, a cough, or a cold. When that bacterial virus enters our body, our immunity tries to send that virus out. This is the role of our immunity, but suppose this immunity affects our liver cells. We call this autoimmune liver disease. So there is a chance of liver disease through our immunity. There are varieties of these, such as autoimmune hepatitis, PBC, which means primary biliary cirrhosis or PSC, and there are many varieties like this. Okay. So there is a chance of liver problems due to this too. So again in kids there are some varieties like Wilson's disease, hemochromatosis, again in adults some like that, so not only alcohol but also other than alcohol there are many reasons that are not related to liver problems. Liver problems also occur in young children. Some people, some people have faced it. Babies are born with jaundice, So, when babies are born with jaundice, some people are called physiological jaundice. That is, this is normal. So, they are put under the young race. After a few days, the jaundice becomes normal. But for some people, there is a chance of problems in the liver, the ducts in the liver. What does the duct mean? Think of this as your liver. The liver produces bile juice, it flows from those ducts and we get digestion. So suppose there is a problem in those ducts, like biliary tract infection. Then their liver does not work. These small children are 5 or 6 days old. Not months, just days, 5 to 6 days, 1 week. They also have a chance of liver failure. So they do not have a chance of permanent cure through liver transplantation treatment. That is, if the liver has failed, generally a surgery is done for biliary atresia. It should be done before 40 days. But suppose it is not detected before 40 days, then this surgery will fail. For them, the only permanent cure is a liver transplant. There are many such children too. Madam, transplantation is mostly a matter of taking a little tension. How is it like, madam, how is that process all that? So liver transplantation, earlier, 10 years ago, 10 to 15 years ago, there was no liver transplantation in India. Only we used to go to other countries outside Singapore and get liver transplantation done. But now, with the advancements we have, due to the very good hospitals and doctors we have, India has got liver transplantation. What is liver transplantation? So there are 2 types. One is that, first, the liver is permanently damaged. Now, we have to see if the liver of those patients is permanently damaged. So permanent liver damage means cirrhosis, as I told you earlier. Cirrhosis means liver cell death but the liver does not regrow. So what happens to them is that the liver that should be this big becomes this big, it becomes this small, the liver shrinks. If the liver shrinks, the pressure in the liver increases, the pressure in the liver increases and the liver fails. So we call them chronic liver disease cirrhosis. So in this, there is a chance of 10% of people getting cancer in the liver. So it is very necessary for them to do transplantation. Now not every cirrhotic needs a transplant. Now there is compensated liver disease in this, compensated liver disease, compensated liver disease, compensated liver disease. Compensated liver disease means that even if there is permanent liver damage, there are no symptoms of liver failure. So to put it in your mind, let's say 80% of the liver is damaged. The remaining 20% will try to work as much as that 80% of the liver can work. Okay, so they don't have immediate liver failure symptoms. Liver failure symptoms mean blood vomiting, that black color motion, the loss of muscle mass. Generally, you are weak for many people. As I said before, the second thing is muscle loss. Why does muscle loss happen? Suppose someone goes to the gym. They take protein to gain muscle. That protein is formed by our liver. So, suppose the liver has failed. The protein is not there, it is going out. So, first, what I see is that their cheeks, jawbones, neck, chest, all this muscle has gone and there is skin on the bone. So, the first thing that we notice is that their blouses are loose or their shirts are loose. The second thing is blood vomiting, or black color motion. As I told you, because of the high liver pressure. Now the liver is under so much pressure. So what does our body do? To divert this pressure, like a top. This top comes with a lot of pressure. It comes out like this. Similarly, the body forms so many collaterals that the liver cannot bear this pressure. So the first example is that these form in our food pipe. We call them blood vessels. Generally, we do not see blood vessels so prominently in the food pipe. Yes, if it is seen due to high pressure, then why does blood vomiting occur? Because of this pressure, those blood vessels rupture and break. So there is a chance of blood vomiting or black color motion. Another failure symptom is that generally, those who have liver problems have a chance of kidney effect. Kidney effect does not mean kidney failure. What happens is that the burden on the kidneys increases and the flow of all that is less. Whatever fluid is in our body should come out through urine, that is kidney function. But what happens in cirrhosis is that it does not come out through urine, it gets accumulated in the legs, the stomach, and the lungs. You see this in the swelling of the legs, you see that the stomach has come this far, in the lungs, this is the accumulation of fluid in the body. Another thing is that the most important function of the liver is to detoxify, which means that whatever is not needed in our body, whatever toxins are present, they are detoxified and taken out through our stools through the liver motion. But when there is no liver function, these toxins go to the brain. Okay, what happens is the first symptom. We generally do not go to bed early, we go to bed at night. This is the opposite. So altered sleep rhythm means they don't get night sleep and they get early morning sleep. Another thing is forgetfulness. They forget small things slowly and slowly. The third thing is falling asleep while sitting up, more early morning sleep. There are grades like this, the fourth grade is coma. Okay, so this is a liver failure symptom, a very important thing. We know now that liver cell death occurs, didn't I say? So anyway, jaundice is present in them. So apart from these, it is very important that when there is liver disease, when there is cirrhosis, why do we need to know that there is a chance of cancer in them? So when cancer comes, we always tell my patients that no matter where you are in the world, once cirrhosis occurs, you should definitely have a CT scan once every 6 months. Why do we have cancer? If we have a CT scan every 6 months, we can detect it permanently at an early stage. So it can be cured permanently, whether it is just a part of the liver removed or a liver transplantation is done. So, these are complications. So those who do not have these are called compensated cirrhosis. Those who have these are called decompensated cirrhosis. Those who have compensated cirrhosis, that is, those who do not have these complications, these liver failure symptoms, some of them are fine for a few years. They should come with regular follow-up, that is, blood tests once every 3 months, CT scan and endoscopy once every 6 months. But those who have this liver failure should definitely get a liver transplant because every symptom that I have told you now is liver failure. This liver will not get better. So as long as this liver fails, you will keep getting these symptoms, so if we only treat it, there is no use. So, what is the causative agent? The failing liver. So if it is removed, these symptoms will stop. Okay, so there are 2 varieties of this. Life donor liver transplantation. Disease donor liver transplantation. Okay, life donor liver transplantation means, for example, a patient has cirrhosis and permanent liver damage. Let's say they are of blood group, it will be decided based on the blood group. Whoever we are talking about is a life donor now, so they should be family donors. Okay, they should be of the same blood group. They should be more than 18 years and less than 50 or 52 years old. They should come forward and say, I will give them to them. Okay, why is this a criterion? Generally, people who are more than 50 to 52 years old have fatty liver. Okay, so even if they have fatty liver, we correct them and take them, that is, younger people. If not, it is an emergency situation. But we prefer, okay, those who are less than 50 to 52 years old. So now, let's say this patient is a patient. Before the surgery for this patient, we will do something called pre-liver transplant evaluation. That is, this is a major surgery. This surgery in the body with a stand, will he be fine without complications for such a major surgery, so that the heart doctors, lungs doctors, anesthesia doctors, everyone will look and say okay, this patient is fit. Also, if there is a donor, who is the donor? A normal person, who has no problems, who is okay with him or her, when they come forward, they too will undergo a pre-liver transplant pre-donation evaluation. Okay, how much liver do they have? Do they have any other problems? First, we need to know if there is any risk during the surgery. The blood group must match, that's for sure. The second thing is that even though they are a donor, when we evaluate them, we know that there is a 1% risk, but we say no. Because it's like giving a complication to a normal person. So, we are the ones who refuse, so there is no need to be afraid. The third thing to know is that whoever donates the liver has zero life risk. Okay, there is no real life risk. In 2 weeks, that is, within 2 to 4 weeks, the liver will grow as much as it was before. Okay, so now the donor has arrived. We evaluated the donor. He has 100% liver, generally from 100%. We evaluate around 30. How much weight does he have? How much weight does he have? And so we have evaluation calculations. Based on that, we decided to take how much. For example, let's say we took 30. Whoever this patient is, we will remove their entire liver, because the damage is done. So we will give this 30% to the patient. That donor will have 70%. He will have 30%. Within 2 to 4 weeks, he will go from 30% to 100%. He will go from 70% to 100%. As I told you, the liver is a regenerative organ, so it will be as much as it was before, so there is no risk from this. Okay, so the donor who is donating should not eat this, should not eat that, should not do that. There are no restrictions or limitations, and there are no medications. Okay, generally they are discharged on the 5th or 6th day. Okay, I know that my particular patient donors are marathon runners, day-to-day life carry-on. There are those who have given everything pre-wedding. So there are those who have married within 2 months. So what do I mean by this for the donor? That is, there will be no complications for the donor. Okay, whoever is the patient, the first 1 month, they have to take a lot of medications. Why is immunity now? Now our immunity is that if any new organ bacteria comes and a small malaria comes, it sends it out, right? So a new organ comes in, the liver is an organ related to that body. We are putting it in, so we suppress the immunity by not sending that organ out of the body, saying, this is not my liver. Quote. Okay, a little bit. So when we suppress that immunity, there is a chance of getting infections. To prevent those infections, there are a little more medications in the first month and the second month. Then lifelong is just 1 tablet, that's it. So that's about life donor. The second option is disease donor liver transplantation. Disease donor means there is no family donor, that is, there is no same blood group, or if they are evaluated, they are not matched, or if the age criteria are not matched, we will take a disease donor. Disease donor means that someone has died. Their family says that the organ they donate is okay. They are brain dead. So now, for example, let's say the patient is in a group, as we told you. We will do a pre-liver transplant evaluation for the patient. When we do a pre-liver transplant evaluation, we put him on the list in a group. What happens when you put it on the list? Suppose someone donates a group organ, a family member will bring that liver from group O and give it to him. First, before putting it in, we will check the organ first to see if it is good or if it is okay to do an on-table biopsy and see if it is a good liver. What caused his death? We will take care of all that. If you know that the liver is good, then you will transplant it. This is a disease donor liver transplantation. So that is about liver transplant. You said that you should use 1 tablet for the whole life and there is no chance of any complications. So generally what I see more is that people who have alcohol-related liver disease feel very normal again, so they will go back to alcohol again, which I don't suggest. So of course, they go back to alcohol again, that is, they repeat that process, cause permanent liver damage, and do the same thing again. There are also those who have had a retransplant. There are also those who have had a liver transplant and then a second liver transplant. In such cases, what happens to some people, madam, is that there are people who have alcoholic liver disease and then go back to alcohol. Okay. Most likely they have family support. First, the criteria we look at specifically is that if someone who has liver problems due to alcohol is getting a transplant, then 1 is psychiatric counseling. You should never go back to alcohol and family support. If you have these 2, generally they stick to it. but there are some who have gone. So they have to retransplant again. Okay, is there any risk? The risk is high. What kind of risk is there? I mean, if you have had an operation and then you have to have another operation, of course we do an evaluation and see how much risk they have. It's all the same process, but if we say there is a risk, we have to explain it and do it again in a surgery area. Yes, that's why. It's a major surgery. But all the people we have done, by the grace of God, they are fine. Okay, the success rate is good. The success rate is more than 95%. Okay, success. Now, basically, those who think they need a liver transplant are coming forward and getting transplanted. That's very important. What I've seen is that right timing. Some people who think they don't have symptoms, just a little while ago, or just this delay, end up getting transplanted as an emergency. Because the liver damage is already done. Okay, but some people who have made the right decision are completely fine. Post-transplant, they will be totally fine. Okay, madam, although many people have the idea that drinking alcohol will damage the liver, that is, if you drink it in moderation, it will not damage it. But if you drink this much, it does not matter. Is that true? Yes, a liver doctor. I should not say that, but there are guidelines. But why do I not suggest this? I mean, these guidelines are made in Western countries. That is, our Indian body composition, Indian body proportion, have not yet been made. What Western American and European studies say is that generally, if a man takes an X amount, then if a woman takes it, there is a chance of a woman getting liver problems than a man. So, a man can take 7 grams per day, a woman can take 24 grams per day, but I will not suggest this because our Indian studies have not been done yet. Okay, madam, lately we have been seeing a lot on social media about liver problems, saying that if you drink this juice, you will get clean, that's it, and that's what they call detox, all. This is real. No, it's not real. I suppose you ask me what the best detox is. Don't underestimate our body. Whatever detox we need, it's all in our body. Okay, correct, without abusing it, our body will tell us that this is not good for you, even after eating and drinking everything like a dustbin. We will not have to go to the point of detox. Okay, if you take that science, you will understand that these things are bad for you only when you eat them. You will understand that these things are bad for you only when you eat them. Just avoid them. What do many people do? Just once. What happened to me? They continue to think that they will remove everything with a detox over a period of time. But there are no miracle juices like that. Nothing works in the market. Okay, just drink something, that is, the body can be alkaline. What does it mean that now, generally, depending on diets, our body's acid content is increasing? So, if you want to reduce this body acid content, you can take detox drinks, cucumber water with lemon and take all of them, but there is no cure for it. That's why I don't promote it, that's why there are no studies so far. Madam, as a general rule, many people get regular health checkups. Is it possible to find out if we have any liver damage in a health checkup like that, or is there any separate checkup? This is the most important question. Generally, when we get a master health checkup, the common ones are ultrasound abdomen and liver function test. It is enough to get these two done regularly once every 6 months or once a year. Now, if we have fatty liver, we will know in the liver function test, and ultrasound abdomen will also know. So, what do I want to tell you about the most important of these two? Earlier, in fatty liver, we used to see fatty liver in 15 cases or 1 in 30 cases. Now I see fatty liver in at least every second case. It's lifestyle, eating habits, everything, socialization, everything has changed, so fatty liver has increased a lot. So we know that it can be detected in both ultrasound abdomen and liver function test. So when these two are detected, liver function test means that enzymes are present in it, they increase slightly, and ultrasound abdomen shows fatty liver. When these two come to me, I first see what caused the fatty liver. So I treat what caused it, and now I have medications, but until 5 years ago, there was no real treatment for fatty liver. What we used to say is, take this diet, reduce fat a little, take carbohydrates moderately, take more protein, lose weight, do strength training. That's what we used to say. But with the current medications, as I told you, even if the fibrosis stage is fatty liver grade 1, grade 2, grade 3, grade 4, and even if it goes beyond this and goes to the fibrosis stage, we have medications that can completely reverse it. So, as you asked, ultrasound liver function tests are included in our master health checkup. If we get that done, we will know. But if there is anything further, we will have to do some more evaluation. Madam, we hear fatty liver, we are talking about it, but what exactly is fatty liver, madam? So generally, fatty liver means, as I told you, liver cells. This is the liver, there are cells in the liver. There are cells in every organ, just like there are cells in the liver. Less than 10% fat is in the liver, that is normal. Okay, but if more than 10% fat is in the liver, we call it fatty liver. So what happens is, let's say this is a liver cell. Normally, a liver cell looks like this. Fat accumulates, it balloons, it gets a little bigger. If you don't do anything about that fat, it's because of sugar, it's because of BP, it's because of obesity, it's because of diet. Why is that ballooning even bigger? So inflammation happens. Inflammation means that now we have a blow here. It turns red around it, we call it inflammation. The same thing happens to the liver. If we leave it, this inflammation will become stronger, and if it gets checked, what will happen to us? We can say that it's checked here, it's fibrosis. Okay, if that too is not treated, the liver will go into permanent damage. Are there any other separate tests to find out what is permanent damage after permanent damage? There are chances that we will know that permanent damage has occurred in the ultrasound abdomen liver function test. Because in permanent damage, the liver size becomes smaller. As I told you earlier, due to the small size of the liver, the veins become formed due to the high pressure. We can know them a little basic idea in the ultrasound. Plus, some tests that should be normal in the liver function test become slightly abnormal. So, if we say altered ratio, AG ratio, we will advise tests like CT scan ourselves. Okay, CL looks like chronic liver disease. We will see these. We will do a CT scan plus an etiological workup to find out what caused it. Okay, if we adopt a healthy lifestyle, we will not have any chance of getting such health issues, madam. What should be the real lifestyle? This is a problem. What I mean is that what can be followed as a common rule is that whatever our sleep pattern is, we should follow it first. It means getting up at sunrise time is okay. 5:30 to 6 is okay, and we should have dinner by sunset time. Many people have dinner at 10, 11, 12. So the first thing is to get up at least 20 to 30 minutes of sunlight exposure is okay. Apart from that, if there are no contraindications, drink 2 liters of water. And do physical exercise. I cannot stress more than that. Physical exercise is very important for liver health. The fifth thing is that you can take good fats. A well-balanced diet should have moderate amounts of fat. Many people do not only consume protein. We need fat. We need carbohydrates. We need a good amount of protein. We need fiber. So if we eat all these, we will have a well-balanced diet. But in moderation, we should not take 10 or 5 purees like that. Now, if you like, take 1 but in moderation. A well-balanced diet is very important. Water is basically our sunrise and sunset. Why should we follow it? The hormones and enzymes released by us maintain digestion and organ health very well. So following it is very important, and of course, we should avoid unprocessed food, which we find in packets and boxes. I will not say that we should not drink alcohol. But binge drinking should not be done. Regular alcohol drinkers have the same amount of liver damage as binge drinkers. Binge drinking means that someone who has not drunk for a year drinks 1 full bottle of alcohol in 1 day, so they have the same amount of liver damage as regular drinkers. Okay. So take it in moderation occasionally. And don't overdo it, and that is very important. Smoking alcohol, sleep is a very good medicine. I think our body will keep telling you sleep. And eat when you are hungry. All these are very important, i.e. if you are not hungry, then it doesn't matter. If you skip it doesn't
matter very much. It
definitely doesn't matter if you skip it. Okay, so some people have a problem with lack of appetite, unlike them. Okay, so other people also skip it. Okay, what I suggest is that intermittent fasting is very common these days. We are also suggesting it, but if anyone falls, they should not start it. It is better if they start under guidance. Intermittent fasting is what we call an umbrella term for periods of eating, periods of fasting. So for example, suppose you wake up early in the morning, your first sip of food, be it coffee or breakfast, is at 6 o'clock, your dinner is at 8 o'clock. So your eating period is 6 o'clock, the rest is 8 o'clock, then your fasting period is okay for the next 6 days. So what is beneficial for us, especially liver-related, in this fasting period, is that insulin resistance decreases. Cholesterol levels are improving. Fatty liver improves. These are proven science. Okay, but along with this, if you eat 1 or 2 biryanis during the eating period while doing intermittent fasting, it will not help. Moderation and balance type. Anytime. But intermittent fasting is surely helping in cholesterol, insulin resistance, weight loss in obese people. Is really helping in fatty liver, of course. Okay. But most of the other diets are very well proven. Why are there others? I don't say much. I mean, there are not so many studies on them. They are doing small studies, pilot studies, right? They are starting. Okay. Now all this has not come to us today. This is what our grandmothers and grandfathers started from now on. Not eating anything on a particular day, ekadashi, whatever it is, only. Taking evening break and only snacking before sunset. All this has been going on since when? Because it is our body's algorithm. Yes, if we follow it, we don't have to do anything else. Okay. Many people skip lunch and eat lunch instead of breakfast and go away. It doesn't matter if they are doing intermittent fasting. Suppose your breakfast time has come during your fasting time. That means you thought you would not eat from 8 o'clock at night to 12 the next day. Suppose your breakfast time is over. If you break your fast at 12 o'clock, that is, if you are having lunch directly, then no problem. But not everyone should do intermittent fasting. Whoever is doing it, please, definitely get guidance. Some people do not like intermittent fasting, especially many diabetics. They get low sugar levels, get a lot of headaches, and so on. So if you find out who can do it, it is very beneficial. There are many benefits. Okay, we should definitely follow the guidance. Okay, madam, when it comes to the liver, many people think that alcohol is the main reason. But does it come when you start drinking or does it come after drinking a lot? How true is that, madam? The answer I give can give some loose ways to many people. But it does not come immediately after drinking. But for some people who do what I said, drinking beans, it is not only alcohol, it is their genetic composition. There are many reasons. Only the alcohol molecule does not cause liver problems. Their genetics, their body composition, and so on, so. Mostly what we observe is that those who start drinking alcohol and start it regularly over a period of time have a chance of getting alcoholic liver problems. Initially, some people get it. Those who drink a lot of alcohol have a chance of getting jaundice. It takes many years for permanent liver damage to occur. But initially, those who drink alcohol have a chance of getting jaundice. We call this alcoholic hepatitis. What this means is that, as I told you, liver cells die, and jaundice occurs due to the death. This is dangerous as chronic liver disease. So if they don't stop drinking alcohol, they will also go into failure directly, like we did with fatty liver fibrosis cirrhosis. So they should also be very careful. But how much did they drink and how long did they drink? There are many people who have drunk alcohol daily for just 3 months from morning to evening and got alcoholic hepatitis and liver failure. 3 months is also okay. So how much do they drink and what do they drink is very important. Okay, anyway, danger is danger.
Correct, exact.
Okay, time for that. That is, the immune system in our body. Our body composition, our genetics, depends a lot on our genetics. Madam, do you think that the liver can also be affected by the effects of human emotions? I don't mean emotions. You must have heard about gut health. So gut health has a direct relationship with brain health. Okay, so what do you think this is because of? Now what do you think of the gut in our body? Most of us think of the gut as the stomach. Gut means the intestines, our small intestine, our large intestine. There are two types of these, good bacteria and bad bacteria. The good bacteria have become less and the bad bacteria have become more. The direct access to this is the brain. Okay. Now it is said that the gut is your second brain. Listen to your gut. Listen to what your gut is telling you. Intuition is because it is your second brain. So the gut has a completely close relationship with the brain. We call this dysbiosis, which means there is an imbalance between good bacteria and bad bacteria. We call it gut bacteria dysbiosis. So when that happens, if there is an increase in bad bacteria, it could be due to stress, eating habits, or lifestyle. So what we see in them is, our intestinal motility means that what we eat is digested, the daily stool is passed, they may have constipation, or loose stools, or gases passed too much, bloating immediately after eating, feeling like there is gas, or what we call small intestinal bacterial overgrowth, which means this is what we call. If there are bacteria in the normal small intestine, generally there are 100 trillion bacteria in our intestine, then let's say there are more than that, bad bacteria, and that is why there is a chance of these symptoms. So, one is this good bacteria, bad bacteria dysbiosis, and the other is that what we eat is because of them, so what directly affects them is that they feel emotionally, they have a chance of feeling irritable or a little there is a chance of mood swings because gut health is very much connected to brain health. Okay, madam, are there any food restrictions for people with liver damage? Suppose their liver is damaged, that is, they have cirrhosis. According to the complications I told you earlier, water accumulates in the legs, abdomen, lungs, which means that the kidney cannot send that water out. Then, if we take too much water or too much salt, there will be water retention, which means that there is a chance of swelling in the body. So, we will check their calculations, their sodium levels, and all that. What we generally restrict for them is that in the initial stage, they should not take more than 1.5 L of fluid per day, whether it is water, juice, coffee, tea, water mixed with protein powder, or water. And salt 2 grams per day is all that. Pickled foods, snacks, whatever they are, they have a lot of salt in them, they should avoid them. Okay, the second thing is that there is protein loss, so there is muscle loss, so they should take more protein. The most important thing is that many people are afraid that even if they have liver problems, they should not eat chicken or fish. Which is wrong. Okay, even if there is no burden on the liver, assume that you are taking non-vegetarian food. Chicken, fish, egg white, etc. are very good for the liver. Of course, deep-fried fries should not be given. But like gravy or boiled is much better. Vegetarian think rajma, chana paneer. Soya sprouts dals that we eat regularly are good in protein, so protein supplementation is very important in liver failure, this muscle wasting, this weakness. I would say deep-fried foods, fatty meals should definitely be avoided. Spicy food also like that. Spicy is okay now, many people are consuming less salt so they can garnish it with pepper or lemon. Our criteria in diet salt water is okay. Okay, that is, as you said before, even if there are no other symptoms, only swollen legs like this, that is, it is in the swelling of the legs. Swollen legs come due to many reasons. One is the liver or there. Any other reason swollen legs cause swelling of the body, that is, kidney problem, heart problem, thyroid and many more. So I am saying that it is caused by liver problems. So there are other things that can be restricted due to liver problems, so what you need to restrict is salt and water. Madam, many people do not really like drinking coffee or tea. They say that it is good for them, but some people say that they should not drink it at all. They should not make it a habit. Madam, can people with liver problems drink coffee or tea, especially? This is a very important question. What recent studies have proven is that people with fatty liver should not have migraines, palpitations. Some people should not drink coffee. People with that problem, other than those who just have fatty liver, 2 cups of black coffee per day, that is, no sugar, no milk. Just black coffee per day is actually beneficial for fatty liver, it reduces fatty liver. Recent studies have told us that for those with fatty liver, as you asked, coffee is actually good. Of course, many people are used to milk and sugar, but if you can change that, you don't have to give up coffee.
Okay, there are.
Not so many studies with tea. So we don't know whether tea is beneficial or not, but definitely 2 cups of coffee per day, black coffee per day. If someone has a contraindication or not, it is good for the liver, it is good for the fatty liver. Okay, madam, many people who drink black coffee say that they can add lemon, mint, etc. to it, so there is no harm in it. Only calories should not be added, that is, sugar, milk, protein, milk, etc. They should not add any flavors to plain black coffee. They can. When it comes to green tea, madam, many people ask, is green tea important? I know that. It doesn't do anything much, that is, it doesn't help with weight loss, it doesn't benefit the liver. I haven't read it yet. We don't even promote it to anyone. Okay, but we hear that many people say that it is very useful for weight loss, as you said. Correct. Okay, but for the total amount, you can drink 2 cups of black coffee. Those who have liver problems can. Definitely. Drink it. Thank you, madam. You have explained it in great detail. Really, if you watch this video from the start to the end, all your doubts related to the liver will be cleared. Thank you, madam. Thank you very much. Thank you.